everyone. Welcome to our Q&A for the vaccination. So we had a lot of you guys submit questions about vaccinations, and we had a lot of people submit questions about the boosters and the flu shots and how that's all going to work out. And so we wanted to take the time to answer all of your questions. For those who aren't vaccinated and are thinking about getting vaccinated, and for those who are and are wondering what's happening with the boosters. So we have Dr. Malley here with us today, and he's going to be answering all of our questions. So I'm just going to pose a question and he'll answer it for us. If you guys at the end of this have any additional questions, please feel free to reach out to us. You can reach out to Advanced Comms or Marie, Dr. Malley, or Brenda, and we can always be of help and answer any additional questions that you may have. So with that, let's go ahead and get started. Our first question, Dr. Malley, is, does the Delta COVID symptoms and recovery parallel with COVID-19?
Yes. So in terms of, so the first question is the symptoms. In general, the symptoms are the same with the other strains, which is basically fever, dry cough, shortness of breath, some loss of taste or smell, and just regular flu-like symptoms, fatigue, digestive problems. So in terms of the symptoms, yes, they're parallel. In terms of the infection rate, though, is much higher, meaning you are much more likely to be hospitalized, about 85% higher with the Delta variant. So it's much more infectious. With the original variant is about 1 to 2. One person gives it to 2 people. Now it's somewhere between one person giving it to somewhere between 4 to 9 people. So it's much more infectious. The symptoms are the same, just that they're much more severe, much more likely to cause hospitalization.
Awesome. If you get COVID after receiving the vaccine, what are the symptoms like?
Good question. So the symptoms are going to be much less severe, is the simple answer. I mean, when a person is vaccinated, most have actually no symptoms. If you were to have symptoms, they're usually very mild and very rarely result in hospitalization or death. And they're essentially more like a common cold in a vaccinated person. As of July 22nd, there were 65,000 breakthrough cases. And among the 160 million who are fully vaccinated, that's 0.04% of vaccinated people reporting breakthrough cases. So no vaccine is 100% effective. With COVID-19 vaccines averaging about 90% efficacy, health experts expect approximately about 10% of those vaccinated could become infected. Although with the Delta variant, we're seeing that's potentially a little bit higher.
Awesome. And how do we know that the vaccine isn't what caused the Delta variant or what's caused the uptick in the COVID cases?
So viruses are not a new thing. The virus that caused COVID-19 is novel. So we can learn from a lot of the other viruses that have come, which is essentially what we're doing. It is normal for viruses to mutate, just like the common cold mutate. That's why we get a cold. Sorry. That's why we get a flu vaccine every year, is because the virus that causes common cold is constantly mutating. So in that sense, this is something that will continually change. And right now, the predominant strain is the Delta variant, but that's going to change in the future. But the good news is, if you're vaccinated, so far these vaccines, they are very effective going across the different strains. So the current, all the different strains are currently in the U.S., which the predominant player is Delta variant, which is approximately 85% of the COVID strains right now are the Delta variant. And it is very effective against it. Think of it not as an on-off switch. So an on means it works, or off, it doesn't work. It's more like a dial, like a dimmer switch, meaning it may be less effective for one variant versus the other. But for the most part, in terms of the key answer, is not so much you get infection, but do you have to go to the hospital? Are you that sick? Or the deaths? That is very low in a vaccinated person.
Awesome. As in the past related to the Cutter incident, too many deaths occurred and the vaccines came to a halt. Where does the COVID vaccine stand on that?
Okay, so the first part is, what is a Cutter incident? So in 1955, the polio vaccine was administered in the United States, which was supposed to be a killed virus, but it was actually given as a live virus, and 5 people ended up dying from it. I think that this was a long time ago, 1955. But there'll always be some mistakes, some things that happen of that nature. But if you look at it today, currently, we have already given over 357 million doses in the U.S. alone, not the world. That's just the United States. This hasn't happened yet, so that's probably the best way to answer that question.
Great. And what's the current death toll of those who have been vaccinated? So because of the vaccination and post-vaccination because of COVID.
That's a good question. So in terms of, this is a very important point. The number one cause of death in the United States today is COVID. To put that into perspective, my entire lifetime, your entire lifetime, really the most of modern civilization here in this country, the number one cause of death has been heart disease, with the number two cause of death being cancer. And for the first time last year, 2020, it was the number three cause of death. Now it's overtaken to be the number one cause of death in this country. Now here is the key. This is the number one cause of death, but it's preventable. It's preventable with the vaccine. It has gone from being a pandemic to being a pandemic of the unvaccinated. What do I mean by that? Well, if you look at the deaths in the US, 99.5% of COVID deaths in the United States are in those who are unvaccinated. Does someone who is vaccinated die? Yes. But that overall represents 0.5% of deaths from COVID. So the main thing here is that, and most of those people have some sort of immune compromised state, right? Meaning they've got organ transplant, etc. Some may not, but for the most part, it's people that are immune compromised, and it's a very small fraction. 99.5% are unvaccinated.
Great. How can a vaccine possibly be FDA approved in such little time? How long have they been tracking side effects? This is experimental.
So, and this is something that's out there a lot, that the word experimental, and even in a lot of these questions here, it's been used over and over again. So, one, just because someone writes it's experimental doesn't mean it's experimental. So to clarify, this is not an experimental drug. And I think there is confusion, and that confusion happened because the vaccine was never initially granted full use like a regular drug that someone takes, like a medication or an antibiotic. It was given what's called, it was granted emergency use authorization. And people took emergency use authorization to mean that it's experimental. So to get emergency use authorization, at that time, they'd already tested it on 650,000 patients to get that. And they found that it was very safe. Now, to get the full approval, it takes many more than 60,000. It takes millions, and you need an extended period of time of following, looking for side effects, all of that stuff. So it took a lot longer. But usually, if you get an emergency authorization, it usually goes through to full approval. Now, here's the thing. If you're looking at the drug that we gave here, the vaccine, which is the Pfizer vaccine at Advanced Urology, the Pfizer drug now has full FDA approval. There is no distinction between that and any drug that you take. Now, it just recently got it. But if you're going experimental because of emergency authorization use, which is not experimental, experimental means they're studying it, this is approved, it no longer even has that. They've amended it from emergency use authorization to full FDA approval. So right now, it has full FDA approval.
Awesome. Please inform us of the Nuremberg Code and how it relates to COVID.
So that is a code that basically set a research ethics principles for human experimentation. This was basically as a result of the Second World War and experimentations being done without people's consent. And this is how essentially we got informed consent. So anytime we operate here in a surgery center or in the hospital, you have informed consent. And now that really doesn't apply here. I think on the internet, people can put a lot of things, and they like to say what they want, and anyone can say whatever they want on the internet. But none of the drugs here were given to people in the trials without their consent. Everything here was done with consent. All of these are, and not just here in the U.S., but elsewhere as well. In terms of in terms of the actual population getting it, remember, before Americans could get it, it had to first get emergency use authorization, where they already tested in over 60,000 people, and then it went through. But now it's fully FDA approved. There is no question of is this experimental or not. So to answer the question of that code, the code basically just refers to ethics guidelines and principles. But this is not something that is being tested on human subjects here in this country, or it's an experimental vaccine being pushed upon to the population. It's not. It's fully FDA approved drug at this point, no different than your high cholesterol medication that you're taking.
Great. And a similar question, I think, is the Vaccine Bill of Rights being ignored?
So first question is, what is the Vaccine Bill of Rights? So the Vaccine Bill of Rights has a name that makes it sound like it's the Bill of Rights, but it is a bill that was brought by America's frontline doctors, which is a fringe group that pushes conspiracy theories about COVID-19. And it's being introduced by some Republican lawmakers in a handful of states. They're basically, what they're trying to say is people shouldn't be forced to take this vaccine. And right now in this country, it's not that it's being forced, it's being strongly recommended, but it's not mandated by the country. It is mandated in many organizations, most hospitals. I do think that in the future, it will be mandated by essentially any healthcare organization, by schools. It's just going to happen just because of it's the number one cause of death. It's shutting down businesses. It's going to hurt our economy. It's going to have a lot of bad implications, and it's very safe to get. So I do think that in the future that's going to happen. But in terms of the COVID bill, the Vaccine Bill of Rights, it's not it's a bill that's being proposed in many states, but it's not some national legislative thing yet.
Great. And last question for this section is, how does anyone really know how effective it is versus our natural antibodies?
So good question. In terms of this is something that's constantly evolving. The question of how long do antibodies last after the vaccine versus after infection, it's being studied. We don't know. It's a moving target. And as there are different variants and different vaccines, it's going to be something that then it's going to be a different answer for different things. But ultimately, the current data suggests that the antibodies last longer after being vaccinated. So it is still recommended even if you had a prior infection.
Great. Okay, so this next question is kind of all about side effects. What about the concern of the vaccine causing infertility or difficulty getting pregnant? There hasn't been enough time to pass to complete studies on this.
Yeah, meaning there are studies going on about it, but you're right. Long term, it's not known. What is known is people who do get COVID. There are studies showing that they can become infertile afterwards. There are a lot of things that we're finding out. So it goes both ways. But you're right. I mean, there's no reason to say why someone would get infertile after getting this vaccine. So why would there be a possibility of that? Meaning, we don't think that that's the case. But is it possible? Sure.
Great. And what about the heart-related issues for young adults in their 20s taking the vaccine?
So millions of doses of COVID-19 vaccine have been given. And there have been only about 1,000 cases of heart inflammation. So doing the math, the Center for Disease Control and Prevention notes that for every million doses given, there have been 67 cases of heart inflammation in boys 12 to 17, 9 in girls of that age group, 56 in those 18 to 24, 6 of them in girls, 20 in males, 25 to 29, 3 in girls. So the risk is quite low, is the bottom line. So two other points to make. So number one is, even if you were to have it after the vaccine, most of these people did fine with minimal symptoms that were temporary and no long-term issues with it. The second point I wanted to make there is, if you actually got the infection COVID, your risk of myocarditis, heart inflammation, is much higher than actually from the vaccine itself, which is very rare.
Great. And how can anyone guarantee the safety of the vaccine for everyone?
A good question. There is no guarantee. Nothing you take is guaranteed. when you drive to work, there's no guarantee you'll arrive safe. If you sleep at home, you don't get in your car ever, there's no guarantee you'll be safe. You could have a fire at home. So there's no guarantees, this is the bottom line. What you're really doing is not looking for a guarantee, but what you're really doing is you're assessing the risk. What if I were to contract COVID versus what are the risks with me taking the vaccine? And when you do the math there, it is very clear that the risk from a vaccine definitely, it's a very low risk. So it definitely outweighs you getting the vaccine versus you taking the risk by if you got the infection, which the COVID is not going away anytime soon. Generally, the way these viruses work is they're going to constantly mutate. And eventually, meaning we got a more virulent strain now, Delta versus the original. And it's much more infectious, much more likely to land you in the hospital. So it likely eventually will get to you. And by you, I mean in Georgia in particular, because by September 2nd, it is estimated that Georgia will be the #1 state with the highest rate of COVID infection. So it is going to be an issue, I think, for most of us at some point. So when you look at it like that, it's definitely safer to get the vaccine than the possible risks that may be associated with this, which overall are very low.
Great. And last question in this section is, the vaccine was released quickly with uncertainty regarding long-term side effects. How can we know it's safe long-term?
So the answer there is we don't know. We're not going to know long-term side effects for a long time. What we do know is that in the short term, it is very safe. What we do know is in the short term, it's the #1 cause of death for Americans. It's preventable. It's the #1 cause of death, but it's preventable. But it's only preventable if you get the vaccine. So we would recommend understanding that we don't have long-term data, but knowing what we do know, it's very safe. It's why I got the vaccine. It's why I'll be getting the booster. It's why everyone in my family has gotten it. And if you look at it, most doctors have gotten the vaccine. So it's the adoption rate in among physicians is extremely high. And that's because we look at pros and cons. This is what we do for a living, right? For every drug we prescribe, et cetera, this is what we do. So for us, it's a no-brainer.
Great. All right, so this next section is all about Delta and the Delta variant. So if you took the vaccination earlier in the year or before the latest strain, is it effective against the new Delta COVID?
So the answer is yes. So 2-dose Pfizer vaccine is 88% effective at preventing symptomatic disease, 96% effective at preventing hospitalization caused by Delta variant. I think that the simple answer here, more of a concept, is once again, it's not an on-off switch as is it effective or not. It's how effective is it? And we'll have more variants after Delta. It's second down after Delta. But I think that the proper way to answer is think of it as, once again, a dimmer switch, that analogy I went back to. It may be a little bit more effective in one variant versus the other, but for the most part, the key is not, does it get you infected or not? The key is, does it get you sick or not? Does it cause deaths or not? And so far, the vaccines, all the current vaccines that are in the US are very, very effective at reducing hospitalizations and deaths for every variant that's currently circulating in the United States.
Great. Should we expect this Delta variant to close everything down like in the beginning of COVID? Is that what's coming?
It's unknown. What we do know is that in areas of this country that have a very high vaccination rate, like Vermont, they really don't have COVID outbreaks. It's very uncommon. Whereas in areas that have a very low adoption rate, i.e. Georgia, we are going to see a significant uptick in cases. And it is definitely going to cause issues, but I don't know if it's necessarily going to shut down. We have already started, we've stopped doing elective cases in many of the hospitals in downtown Atlanta, given that volume. Many places in Florida are doing it. So many places are doing it, and that they're gone back to doing that again. But what's going to keep on happening, it's still unknown.
Great. And last question is, how's this vaccine being pushed to cover the Delta variant? And other virus vaccines, they're updated to cover mutations and variants, right?
One reason this SARS-CoV-2 vaccine is throwing out variants and will continue to do so is because relatively few people globally have been vaccinated. In the US now, the majority, meaning it's about 57%, have been fully vaccinated, but globally, it's actually a very low number. So the virus is like, yep, I've got plenty of people I can infect. The more I replicate, the more I can mutate, meaning the more times it replicates on someone, if it's something that doesn't catch and doesn't spread to many more people, it's going to eventually die off. The variants that are much more likely to spread to many more people, it's going to spread exponentially faster. So it's basically going to keep on mutating. If we get the vaccine, however, you have a much smaller pool for it to replicate, for it to spread, and as that happens, it basically eventually does get fizzled out.
Great. So moving on to some testing questions. How are they testing for each variant when the test for the regular COVID-19 was not accurate? Is there a new test for all the other variants?
So it's not that the COVID-19 test was not accurate. So there are many tests out there. So there's no one test. There's many tests. Most of the tests are very accurate. There are many variants. There'll continue to be many variants, and tests will change. But I think the bottom line here is, for the most part, the tests are very accurate, and more importantly, the vaccine is very good. So get the vaccine, so we're less worried about testing in general.
Great. Similar question. Due to the recent reports that the COVID tests are not working, how do we know the actual number of COVID cases?
So the answer is we'll never truly know. But if you're looking at the CDC, they estimate that only 1 in 4 infections are actually reported. So we're definitely, or it's likely that it's being underreported. But the thing to focus now on is we know this is a big problem. We know it's being underreported. We know that it's the number one cause of death in this country. But we also know that we can change that. We can prevent that. It doesn't have to be the number one cause in 2022 and 2023. We can stop it. If enough people get the vaccine, we go back to heart disease being the number one cause. We already have, for African Americans, for example, their life expectancy in this country has gone down because it's killed so many people that their life expectancy now has been cut short by several years. So this is having huge impact. People just don't realize, or some people don't realize the severity of it, unfortunately, until it's too late. So it's important to get vaccinated because we can change this. This does not need to be the number one cause of death in 2022.
Great. Couple more questions. If you are vaccinated, have been infected with COVID, can you be infected again during the period that you still have the antibodies?
So if you got COVID infection, it is still recommended that you get the vaccine. The reason for that is it is thought that the antibodies last longer in a vaccinated person as opposed to someone who just got the infection. But if you truly did get the infection and it's been recent and you have the antibodies, yes, you should be protected. The question is just how long are those antibodies going to be there? And that's still something that we're learning, both in the true natural infection as well as in those who are vaccinated.
Oop, I was still muted, sorry. What about the flu shot? Do we need that too? Does there need to be time between the booster and the flu shot?
So yeah, shot and a COVID, one will not protect you for the other. We've seen flu infection go down because we're all wearing masks, but you still need your flu shot. The official CDC recommendation is you separate the flu shot by 2 weeks from the COVID vaccine. And we'll be getting the flu shot, I think, for our company in the end of September. At the same time when you're eligible for your booster for the vaccine. So we would just say separated by 2 weeks.
Great. And will a COVID vaccine ever be required to remain employed at Advanced?
So right now we don't have any intention of making it mandatory, but I will say that in the future, I do think that in the healthcare industry, it will become mandatory. If you look at most hospitals currently in Atlanta, whether it's Emory, Piedmont, et cetera, they're already making it mandatory, meaning at Emory. After October, if you did not get a if you don't have proof of that you got the COVID vaccine, you can no longer be employed by Emory. And Emory is not alone in this. Nationally, if you look at it, so Pennsylvania, many institutions, it's becoming mandatory. And part of it is they're not going to survive without doing it. And part of it is a lot of other people are suffering because of people not getting the vaccine, meaning just regular health problems are not being taken care of because of hospitals being flooded with preventable infections. And as a result, normal problems people always had prior to COVID cannot be treated, and those people are dying. So part of it is an ethical reason.
Great. And will there be another vaccine event at Advanced?
So probably not is my current answer. And when we offered the vaccine here, it was a very different time in the sense that you could not go to Walgreens and get the vaccine. It just didn't exist. It was very hard to get. And we were in that tip of the spear, that 1A category where we were eligible for it, but had to be kind of provided by that organization. But now that it's available everywhere, we probably won't be offering it.
Great. And the last section is all about boosters. So the government announced that we should get a booster now 8 months after your shot. Why? What are your thoughts on this?
So what we always knew is whether you got a regular COVID infection or you got the vaccine, the immunity won't work forever. But to go back on, it's still actually very effective. Both the two main ones, which is Pfizer and Moderna, both of them are very effective at reducing hospitalizations and deaths. It's just that it's not as effective as time goes on. Initially, they came out and they said, if you are moderately severely immune compromised, we want you to get the booster shot, because those guys, when they get the vaccine, it's just not going to be as effective in a fully immune competent person, a person who can mount an immune response to the vaccine. But they've changed it to now incorporate everyone. Everyone should be getting it. And essentially what they're trying to do is, with this Delta variant, what we're finding is when the infection is in our noses, we can still spread it to other people, and we don't have as many, our immune system isn't as robust in the nose, but as the infection goes down our airway, your immune system kicks in and it gets rid of it in a vaccinated person. But until that happens, while it's in the nose, it's potentially very contagious. So what we're finding is with this Delta variant, which we didn't see with the other variant as much, is that even in a vaccinated person, they're potentially spreading it to other people. Even though they're probably going to be fine, it's going to spread a lot more, because once that unvaccinated person gets it, they're going to be much sicker, et cetera. But now you have a source of people who before were not spreading it because they were vaccinated, now potentially may be spreading it. So they want to reduce that number even further, and a booster is one way of doing that.
Great. And is it mandatory to take the booster shot after 8 months of having the Pfizer vaccine if offered at the office?
No, right now nothing is mandatory. The booster, we would definitely strongly recommend it. I plan getting booster, but it is not, even if you never got the booster, just the fact that you got the vaccine for the most part is still going to be protecting you. Meaning we're still talking about, so far out, if you got, your vaccine last year, basically, we're 8 months out now. It's still going to be in the over 80% efficacious range. So it's not that it's not effective anymore. It's that it's less efficacious now compared to when you originally got it.
Great. And will we be offering boosters at the office?
We don't currently have plans on it, but it's readily available, at Walgreens or Walmart or many of those stores.
Great. If we were vaccinated through Advanced the first round, when should we get the booster? Also, do we need the same manufacturer for the booster that we had for the original vaccine?
So the recommendation is after 8 months, you're eligible for getting the booster. So the timeline is 8 months from when you were vaccinated. With regards to, does it need to be the same company? Meaning if you got Moderna, does it have to be Moderna again? Can it be Pfizer? The CDC says, yeah, they'd prefer that it's the same one, but it's not that's required. Meaning, and they're doing studies on it, but probably you can switch around, and there's no meaning it would work pretty close, even if you went to a different company.
Great. And this is a random question, but when we say 8 months, that's 8 months from the second shot, correct?
Yep.
Great. Can we get the antibody test rather than a booster shot?
Yes, you can get an antibody test, but the antibody test will just give you an idea of are you protected from getting sick whereas the booster shot isn't to see the degree that it'll protect you, but is to actually protect you. And it will increase your level of protection, whereas one is just testing to see what is the level of protection that you have. I think you're muted, Marie.
I don't know why I keep doing that. Sorry. The next question is, will I need the booster? Who needs it? When will I need it? Will Advance offer it? I think we've actually answered all of those questions. So I'm going to skip to the next one. It says, is it recommended to get the other type of vaccine for the booster shot, Moderna, if you had Pfizer originally?
Yeah, and this is, once again, the CDC does recommend that you stay with the same, but it's not that it's strongly recommended, meaning you could switch. And more important is just getting the booster, which one is not as important.
Great. And is the booster shot different than like the original shot?
So the answer is no. It's the same dose. It's literally the same vaccine that if they were to come and you said, I've never gotten the vaccine before, they'll give you the exact same one as you said, I've already had 8 months ago. They'll give you the exact same thing. The only thing that's different is the terminology, meaning the booster is the same thing, just given 8 months down the road. A booster is, the concept of it is boost your immunity more than what you had before, but it's the same thing.
Great. Last question, I think we did answer. How do you know if, or boosters, Pfizer? Yes, that's what's recommended. How do you know if they're giving us the right booster?
Well, once again, you can get anything that's out there, any vaccine, even if you got Pfizer before and now it's Moderna, it doesn't really matter. The CDC does say, though, try to stick with the same company. Although more important, even from their standpoint, is getting a booster, not as important as which is the company.
Awesome. Okay, so that was actually all of our questions. So thank you so much, Dr. O'Malley.
Yeah.
We do have a quick slide here for things to consider. Did you want to speak on that?
Yeah. So in terms of so not getting a vaccine does have a trickle-down effect that sometimes I think we just don't see. So one of them is that the virus will continue to mutate and could eventually make the vaccines less effective or ineffective, meaning as long as there's a pool of patients that the virus can infect, it can replicate and then it can mutate. If that pool of people that can be infected is much smaller, it's going to happen less and be less of an issue. So in general, things like polio, you can get rid of it if there's no one to infect. And then you don't need the vaccine anymore if that's the case, right? So in that same sense, if enough people get the vaccine, this goes away. That's the simple answer there. But if enough people don't get it, it's here for years to come. And it's not like it's way down here in the cause of death. It's the number one cause of death of any cause of death in the United States, period. So the second point here is the virus spreading increases the number of hospitalizations, which overwhelms the hospital system and prevents patients with other conditions from getting the care they need. So my cousin, he works at Kennestone, which is the number one busiest ER in the state of Georgia. And he was telling me about a case the other day, and he's saying right now the average wait time when you go to the ER is about 17 to 18 hours over there. If you come by ambulance, it's a shorter wait time. It's maybe 3 hours. But if it's you drive there yourself, it's 17, 18 hours. So what happens is someone comes in and they have medical problems that they've always had, like a heart attack or a stroke or some other problem, but they cannot be seen in a timely fashion. And as a result, they're dying of preventable things is because they don't have the nurses to see them. They don't have the doctors to see them. They don't have they don't have those resources. And people are upset, and then they're suing, and they're doing all these things. But the real problem here isn't that they don't want to see them. They're overwhelmed. They don't have the staff. They don't have the ability to do this. And so people are dying of things that we can treat simply because the hospitals right now are so overwhelmed with COVID cases. This is just because you may not see, until one of your family members gets it. It's still extremely common out there, and we see it. Meaning, as a urologist, I don't treat COVID per se, but I treat patients with COVID. When's the last time I saw a COVID positive patient? Yesterday in the hospital. The guy had been there for 2 months. He has to have many nurses go in there, physicians. We go in there, and when they get sick, they want care. Now they're getting many drugs, medications, and then we are potentially spreading it to other people. So that's the issue that's there. So think of that issue as well. And then many of the physicians that are taking care of them are also getting frustrated because it's now preventable. Before it wasn't, and everyone is at risk, but now it's preventable, and they're not getting the vaccine, but now they're taking up resources, staff, and people who otherwise have problems that can be treated can't be treated, and it's being delayed, and it's causing problems for other people. And that's people are getting frustrated with that as well. The third point is you could be spreading the virus to those who are unable to get vaccinated. So one thing with the Delta variant is that children are more susceptible, and until the vaccine gets approved for children, they're still at risk. And it's still way less of a risk than an adult, but it's still a risk. And by getting a vaccine, you are reducing a child from getting COVID infection, which is doing your part there, I think, to for our whole society as a whole. So even though there's a chance of breakthrough infections, which is very uncommon after vaccination, the vaccine does, for the most part, significantly reduce severe illnesses, hospitalization, and death. Meaning, I think the biggest stat there is it's the number one cause of death in this country to date of any cause of death. Yet, if you're looking at those deaths, only 0.5% are in the vaccinated. 99.5 are in the unvaccinated. That's really the punchline. I mean, the moral bottom line here is this is now an epidemic of the unvaccinated.
Great. Well, those were all of our questions. Thank you guys so much for sending them in. A huge thank you to Dr. Malley for taking the time this afternoon to talk with us and answer all those questions. We really, really appreciate it. And again, if you guys have any additional, feel free to reach out to any one of us, and we'll talk to you soon. Thank you. Have a good night.
Thank you, Mary. And from my end, I'm more than happy to talk to anyone one-on-one. If I can change anyone's mind and get the vaccine, I have no problems talking to you. So just reach out to Maria, Brenda, and they'll give you my cell phone. So if someone wants to talk to me, please reach out. I'll be happy to talk to you guys.
Great. Thank you, Dr. Malley.
Thank you, guys. Bye.